All right, everyone, welcome. I'm Dr. Sally. Today, I'm going to be walking you guys through a treatment for the low back. The patient today has a history of a lot of low back pain, mostly stemming from something called the sacroiliac joint. So what we're going to see today is we're going to actually do some injections of platelets into the actual sacroiliac joint. We're going to do some work on the stabilizing ligaments that sort of hold that ligament in place and attach it, or hold the joint in place and attach it to the pelvis. And some work on the musculature that also helps with stabilizing that whole structure. It can also prevent some additional sciatica type pain that might be creating problems down into the back of the hip and into the leg. So we'll go through all this and you'll see some of the treatment. You'll see how we approach the treatment through the x-ray, and we'll be using a little bit of ultrasound to kind of get through parts of the procedure too. So stay with us and we'll get through this and get it all treated. So now that we have the joint taken care of, the next step is going to be securing the platelets within the joint. So what we'll do now is we'll mark out a couple different places along the joint, sort of along the bone on the inside here, and we'll actually use those landmarks to inject into the ligaments across the sacroiliac joint, and that will provide some added stability for the whole complex itself. See the contrast actually extending out across the sacroiliac joint here to the outside of the hip, and then some of the flow patterns down into the lower part of the hip here where the ligaments cross over the bottom of the joint. So we got a good stabilizing pattern across the top and the bottom. Now we'll go ahead and inject some additional platelets in this area. So now what we're going to do is we've stabilized the actual joint itself and took down some of the inflammation there, and then the ligaments across the joint. Now we're going to work on some of the muscle structure. One of the main muscle structures that we want to address in this procedure is the piriformis muscle. And here on the ultrasound, we can see the piriformis actually extending down from the tailbone down to the outside of the hip where it attaches. And this is a very common area of pain, not only for sort of sciatica and low back pain, but also for lateral hip pain. So what we'll do at this point is we'll inject the bottom aspect of the piriformis and we'll work on some of the additional gluteal musculature as well.